nothing short of alarming. In the last month alone, since early November, our daily infections have tripled. Our hospitalizations have more than tripled and are at a new peak. And our deaths have nearly doubled, and they continue to rise. These numbers don't reflect last week's record-breaking numbers. They don't reflect yet the Thanksgiving effect of time spent together with families when many people were gathering and traveling in defiance of public health warnings. And here in our Golden State, unfortunately, California has one of the fewest numbers of hospital beds per capita compared to other states. So if cases continue on this pathway, if they continue to increase at the pace that we've seen, the county expects that we will run out of hospital beds here in Los Angeles by Christmas time. The public health of our city, the public health condition of our city, is as dire as it was in March, in the earliest days of this pandemic. So tonight, I want to speak, as always, to you candidly, with the truths and the statistics that I get as soon as I get them, to share them with you, and to know what we can do in the coming days. It's as much what you choose not to do as what you do that will determine what happens here in our beloved hometown. The choices between us are stark, between health and sickness, between care and apathy, and yes, between life and death for too many of the people that we love. My message couldn't be simpler. It's time to hunker down. It's time to cancel everything. And if it isn't essential, don't do it. Don't meet up with others outside your household. Don't host a gathering. Don't attend a gathering. And following our targeted safer at home order, if you're able to stay home, stay home. Just be smart and stay apart. That's our message tonight. And this is how we'll keep ourselves safe. This is how we will protect our workers, our healthcare heroes, who I want to thank, who are on shift after shift after shift, with little light at the end of the tunnel. This is how we will protect our communities and our families. I know that everyone is hurting, especially in this moment, our restaurant workers and our children who are school-aged. So before I dig in deeper to today's numbers, I want to share two new announcements of things and the work that we are doing to help those vulnerable populations. The first affects our small businesses and restaurants, so many of whom are the heart of our neighborhoods and of our city, of our creativity, of our entrepreneurial spirit, and so many of them have been dealt devastating blows throughout this pandemic. With outdoor dining suspended at our restaurants, the losses suffered by the industry's workers and business owners are mounting. I've heard the pain in the voices of our service workers and from our restaurant owners. And I've seen it in the data, which shows us that approximately 4 in every 10 people who work in full-service restaurants have already lost their jobs this year. With limited federal support, which I'll get to later, and the county public health department's new orders about outdoor dining, the city must step up to provide relief to restaurants. So tonight, I can announce the launch of Secure Emergency Relief for Vulnerable Employees, or simply put, SERVE. The SERVE initiative is a new measure to deliver relief to our city's restaurant workers. It's a partnership between my office and to mayorsfundla.org. Every contribution matters. And while we step up to help one another here with these new initiatives, I want to also take a moment tonight to speak about Washington, D.C., and the need for our leaders in our nation's capital to step up. You know I have been a very loud voice, not just here from Los Angeles, but organizing mayors across the country in a bipartisan way, engaged in negotiations both with the Trump administration and with congressional leaders to say we need help now. We're on the front lines. Our workers are on the front lines. Our healthcare heroes are on the front lines. And yet local and state government has been left behind since May. We need to have a package that helps us now. And today, it was good to hear that we had bipartisan support for a new proposal of $908 billion to be able to, right now, pass help for the American people. The details included small business assistance to the tune of $288 billion with a focus on our restaurants and hospitality and live entertainment, which have been so hard hit. $180 billion of unemployment for workers who have gone off a cliff and gotten a pay, essentially, reduction, while leaders in Washington, D.C. have not seen a pay cut. $160 billion for state, local, and tribal governments. And this one is critical for us if we are going to have a chance of forestalling the cuts to services, the furloughs, and yes, even maybe the layoffs here in Los Angeles. We need to see that help now. There's $82 billion for our schools, $45 billion for transit, our public transit, which is serving people who are still going to work, who are essential workers or on those essential trips, but also that faces a fiscal hole. For our airports and our airline industry and those workers. Food aid of $26 billion, $35 billion for healthcare providers. Rental assistance for people who need to pay the rent, $25 billion. And critically, $16 billion for our testing, tracing, and our vaccine rollout so that we can finally get through this crisis. There's other money for community lenders and for broadband, for post office support, for childcare, for opioid treatment, and for student loans. But I hope no congressional leader will reject this out of hand, but instead do the hard work to get this done. It's not just a list of numbers. These aren't just statistics. It's the difference between survival and freefall, between housing and homelessness, and yes, between life and death. There's so much more to do from the federal government, from extending the moratorium on evictions, providing mortgage relief, and much more. But as Joe Biden, our president-elect, said, this is a good start, and it's something that we should all get done now. I hope every member of Congress from both parties will not go home for Christmas until this is passed and before our president signs it. So the stakes, my friends, have never been higher. The situation has never been more dire, and the data today bears that out. Today in our county, we had 5,987 new infections, 2,119 of those right here in the city of LA. If we stay on this case trajectory, LA is projected to reach 574,644 total cases. That's more than 500,000 of us by the end of the year. And if things don't change, the worst number of all is the projections of the cumulative deaths this year. 11,130 lost souls. That would mean that 3,390 more Angelenos could die in a single month. Let me put that in perspective for you. That's as many deaths in a single month as we have from homicides in an entire decade. We are staring at the face of tragedy, of loss, the valley of death that is in front of us, and yet we can get through it together, save lives, cut that number down. I hope that I will be receiving questions 4 or 6 weeks from now about how those numbers didn't hit the projections. But right now, that's what our public health professionals project will happen. See, COVID surging doesn't just mean people dying directly, though, from this pandemic. It also means that our hospitals will become overwhelmed. And so if you have something that's life-threatening and not COVID, you might not be able to get into that hospital or get that bed that will save the life of you or of a loved one. There simply wouldn't be enough medical staff, ICU beds for every patient. And the state is warning that while we might be able to expand the number of beds in many of our hospitals, and I want to thank our hospitals who are heroically working to plan for that, there simply aren't enough healthcare workers in California to cover the shifts. The transmission rate here in Los Angeles is now projected to be down slightly. It is one of the few rays of light, and I hope it's a reflection of the hard work we've all been doing the last few weeks. Our R0, or our transmission rate, is now 1.14, down from 1.27 last week. That means that the numbers of infections, though, unfortunately, is still increasing. Whenever that number is more than 1, it means every 1 new infection is resulting in more than 1 infection as a result. Remember how this virus spreads. The CDC defines an exposure as contact within 6 feet of someone with the virus for a total of 15 minutes or more as the most likely place that spread happens. So staying apart, hunkering down, That's how we're going to reduce transmission. It's that simple. Right now, 2,572 of our fellow Angelenos are hospitalized because of COVID-19, a 5.5% increase since yesterday. Across the county, there are 479 available beds left, including 393 in acute care and just 86 in our ICU beds. As I mentioned, in 3 weeks, our hospitalizations have doubled, and in the last week, we saw a 42% increase alone. And at this rate, we will run out of beds in the next 2 to 4 weeks. We have 601 families who have a loved one in an ICU bed right now because of COVID-19. They're severely sick, and they're hanging on, praying that their loved ones will survive. This is a major increase since last month when there were just 346 people severely sick. And this is, to me, one of the most frightening statistics, that our healthcare worker infections are up by 71%. Our hearts go out to those who are saving our family members and working every single night in the face of fear, in the trauma of the death that they witness, and now who are getting infected. It's a double blow because it could mean they could get sick, they could be hospitalized, and they could themselves die. But it also means they're out of the workforce while they're infected, meaning that our hospitals are even more pinched, making it tougher for all of us to get the care we need. So do it for all of us, but do it for our healthcare workers too, whether they're cleaning a hospital or a tech, a nurse or a doctor, or anyone in the hospital administration. Do it to make sure they can continue saving lives. The worst part of each of these briefings is the statistic about the number of Angelenos who have died. And the county announced 40 more deaths today. We mourn for every life, every set of dreams lost and cut short. And we know, too, that this figure is a lagging indicator, and we expect it to go up consistently for the next couple weeks. We know as hospitalization rates go up, that deaths follow. And we can't forget another key fact about the numbers, that this disease takes several weeks to show up in our data. So this is just a snapshot of where we were at the beginning and the middle of November. It's not actually a snapshot of today. What we may see in the coming weeks is something that Dr. Fauci called a surge upon a surge, a December wave on top of a Thanksgiving wave that's followed by a Christmas wave. We just can't let that happen. We have to do everything we can to prevent it. So stay at home as much as possible. In these critical weeks, it won't last forever, but it will make all the difference. And it will shorten the time that we do have to stay at home if we all opt to stay at home. Don't share your air. Don't gather with other households. And know your COVID-19 status by getting tested if you think that you've been exposed. As of this week, we've conducted in city sites 2.5 million tests since the start of this pandemic. And the current 7-day positivity rate at city sites is 11.5%. I promised you from this podium that we would expand testing to meet the higher demand, and we have delivered on that promise, more than doubling the tests each day in just over a month. And I want to thank our heroes from the Los Angeles Fire Department and the volunteers of CORE, whose work you can support by donating or signing up to volunteer at coreresponse.org. This amazing organization based here in Los Angeles that are the ones that you see when you drive through those centers or walk up to those centers. Coreresponse.org needs your help. We have the capacity now to test more than 39,000 people every day, including new testing capacity now at San Fernando Park, at LAX, and additional mobile units that we've brought online. We've worked really hard to reduce wait times at sites to meet this moment. Now about just 30 minutes at Dodger Stadium as of today, 10 to 15 minutes at most of our other sites, and with no wait at San Fernando Park and at Crenshaw Christian Center. Today and tomorrow, mobile teams are conducting testing in North Hollywood, in Boyle Heights, and 3 different sites in South LA to keep our momentum of keeping down deaths in our most vulnerable communities. We've also maintained one of the quickest turnaround times for tests in the country, especially of an operation of our size, ensuring that